Welcome to the Afterspin. Opinions from thought leaders in our state. Peg O'Connell, the Annie Casey Foundation, recently released a report showing North Carolina is in the bottom half of the states for the health and well-being of our children. For instance, in 2008, 1 in 5 children lived in poverty. Today, it's 1 in 4. Even though our state made gains in 9 of the 16 categories, the report said it was obvious that many children have been left behind in this economic recovery. What's your interpretation of this report?
Well, you know, Tom, I think it's absolutely true. As the economy's improved, that we sitting around this table have done better, but there's still a lot of families in North Carolina who have not. And I think what we're seeing is that income divide in North Carolina grow wider and wider. We're becoming a state of haves and have-nots, and our children are suffering for it. If you look at the report, we're at 35, and Virginia is at 14. So that's an awful long way to fall by simply crossing the state line. I think if you look at what are the drivers of these poor numbers and these poor grades for North Carolina, you know, one of the things that's very apparent is the parents of these kids struggle to find stable jobs and stable employment. They struggle to find affordable housing that doesn't take every cent, every expendable cent out of their pockets. I think we've also made some bad policy decisions in North Carolina which drives this, and that's one is abolishing the earned income tax credit, and also reducing access to child care subsidies for parents who are working parents of school children. If mom can't work, then there's not going to be food on the table. Also, the report points out that we're starting to see a greater number of high poverty communities in our states, areas that just are never going to be able to pull out of this, and where kids grow up makes a big difference. We need to do something about this. I think where we did come up in some of the grades, in education and in healthcare, are places where we've actually put our shoulder to the wheel, our nose to the grindstone, or whatever you want to say, and have focused efforts, resources, and commitment on making things better. Things around reducing infant mortality, which North Carolina has done very, very well. In addition, we've also increased access to health insurance for kids through CHIP or through Medicaid expansion. And also, you know, things like, you know, which Jim Long loved, child passenger restraints. We don't have kids flying all over the back of the car. But it's still not good enough. We know things that work. We need to do more of those things.
Well, thank you for watching the Afterspin. We'll have more video all during the week on ncspin.com.